So, Dr. Banik, as the expert on nutrition, can you give us some very, intense, in-depth discussion of what you're talking about above and beyond green leafy vegetables? Because I think most eye care providers, that's where their conversation stops.
Yeah, and this is my passion. I absolutely love this topic. So I'm so excited to share this. So so we know that patients who have high levels of lutein and zeaxanthin in their diets have reduced rates of progression of AMD, going from the earlier intermediate stages to the more advanced stages. So we know that from multiple studies. The question is, how much do people really need? And I think that's where eye care providers may not really be aware that there are studies to show that most people need about 6.5 milligrams of lutein a day. Now, some studies actually argue that that's higher, at least 10 milligrams or even 20 milligrams a day. But the truth is, most people on a Western diet are only getting about 1 or 2 milligrams of lutein a day. So there's a huge deficiency there. There's a gap there. So we want to promote natural food intake that will help support that. So what are the foods? Now, of course, we always think about the leafy greens, and yes, we do need them. Spinach, kale, collard greens, dandelion greens, Swiss chard, these are all excellent sources, but there are also some other sources that people may not realize that they can include in their diets to provide their eyes with lutein and zeaxanthin. So for example, yellow and orange fruits and vegetables. So corn is a great source. And then also there's yellow peppers, orange peppers, even some spices. So many people don't realize that spices can provide you with some of these macular carotenoids. For example, paprika. You can sprinkle a little paprika in your soups or your salads, and that will help boost your intake. Also, saffron is a great source of zeaxanthin. So there are many other sources of these great eye nutrients beyond just leafy greens. Now, I think for some people that's really like, wow, I never even thought about it like that. But there you can, some people don't like to eat leafy greens, so you can give them some options about what they could do to boost their intake in their diet.
When someone asks about a supplement or taking a vitamin, what do you have that conversation around? Because I know I have many patients who have a family member with macular degeneration and then ask me, well, should I be taking a vitamin?
Yeah, I get this question all the time, and I don't know, Dr. Haynes, if you probably do as well. But I'll just give my opinion first, and I would love to hear what you both think about the topic. So, the standard in terms of supplements are the AREDS studies, AREDS 1 and AREDS 2. And they included very specific formulations of vitamin C, vitamin E. AREDS 1 had beta carotene, but then AREDS 2 had lutein and zeaxanthin, also copper and zinc. And those studies showed there was some benefit, not a huge benefit, but some benefit for patients with intermediate stage AMD in helping them not progress to advanced stages of disease. So most of the eye care community will tell their patients, okay, only take the AREDS supplements if you have intermediate stage AMD. If you don't have that, there's no role for supplementation. And actually, I was just having a conversation with a retina colleague today about what he tells his patients, and that's exactly what he tells his patients. If you have early stage, don't take it. But what I tell my patients is, okay, you may not necessarily want to take the AREDS 2 formulation, but you should make sure, number one, you're getting these nutrients from your diet, but also take a supplement that has lutein and zeaxanthin in it to fill that dietary gap. So that's what I advise my patients to do. And then beyond that, there is also research to show that omega-3 fatty acids are really helpful. The AREDS 2 study didn't show that there were that much benefit, but studies that look at food intake of patients who have high dietary intakes of omega-3s, they tend to have lower rates of progression. So I tell them, make sure you're getting your omegas. If you don't get enough omega-3s in your diet, then take a high dose supplement of omega-3s. So that's my personal kind of take on things. I tell patients, don't wait until it happens. Do whatever you can to try to prevent it from happening.
Dr. Haynes, is that similar to your approach, or?
It is. And it is interesting. A lot of folks do stick with that standard of really having to have intermediate AMD before they recommend supplementation. And a lot of that does come from the fact that, at least to my knowledge at this time, there is still nothing that shows that supplementing at an earlier time ultimately reduces your risk of developing advanced stage AMD. But there's still a lot of things that suggest that benefit, even some potential like visual function benefits from lutein and zeaxanthin. So I agree with Dr. Rani. I do tend to reserve that full AREDS2 supplementation to patients who are more in those intermediate stages. But I do also think there is kind of a shift in the healthcare community or the eye care community in general towards supplementing, at least with lutein, zeaxanthin, maybe mesozeaxanthin and things like that in patients who are in those earlier stage categories. And it seems like a very reasonable and rational situation, especially as Dr. Rani said, knowing that our diet really is quite deficient in those things. And I have some patients who have better diets than others, and I have some that really do a good job and prefer to get their nutrition from their foods. And I think that's totally fine as well. But we know a lot of folks are not, and that seems like a really reasonable strategy.
Yeah, I just want to add to that a little bit, Dr. Haynes. You mentioned mesozeaxanthin. So when the ARED studies were done, AREDS2 in particular, we didn't really know that much about this particular macular carotenoid. And now we know that it's right at the center of the fovea. And of the three macular carotenoids, it perhaps is the most important of them. And so there have not been any really large scale studies looking at, like the AREDs, looking at specifically mesozeaxanthin on its own, but in conjunction with lutein, zeaxanthin, and also astaxanthin. So there are some other smaller studies that show that this combination of macular carotenoids, maybe with astaxanthin, may be helpful in fighting macular degeneration. So the good news is that I actually heard recently that there's going to be an AREDS3 coming out soon. So we will hopefully have a lot more information about how to counsel our patients based off of they're actually coming up with a new formulation, the AREDS3 formulation. So it'd be interesting to see what happens with that.